We're joined by Doug Clark, and we've been waiting for this for quite a long time, haven't we, Doug? Because it got cancelled. All our fault. We were busy, and you very kindly invited us down. So I want to start with, what is chiropractic? Chiropractic, a chiropractor? How do you even phrase that?
It's chiropractic with a hard C.
Okay.
That's the profession. And the person that does it is a chiropractor with an OR at the end.
Okay.
So chiropractic, it's a form of physical therapy, manual therapy. So we use manipulation to loosen up stiff joints. And by loosening up stiff joints in the back or in the neck, we improve the way in which that joint moves. And then the nerves and muscles around that joint respond better. And that deals with things like pain, range of motion, and helps with things like strength and muscle control and things like that. So
you'll probably agree with this, that the human body seems to be pretty good. It's a very clever thing.
Yeah. But
why would it need changing? So why does a joint now and again need clicking and moving from where it is to a different place?
Well, it's not really about moving a joint from A to B. It's not that the joint has come out of socket. It's more that the things that we experience in life, whether that be some postural or ergonomic stresses at work, if we're a bit lopsided in what we're doing and we're always sort of turning our neck to the one side in the workplace, then you're likely to get a line of stiff joints down one side of your neck. You might move joints through an excessive range of motion. So they go through too great a range of motion and then they get sore because they're hypermobile. And you get reactions to that in the body, so that the nerves that are in our joints and in our muscles detect movement and joint position, and they'll send messages to the bits of our brain that control the rest of our body. And so the way the brain might respond to continually turning your head to one side is to send a message down to tighten things up on the left, to pull you back again. And over time, you develop regional stiffness in different parts of the skeleton. And that's really where the chiropractor comes in, because it's targeted manipulation to restore movement to the stiff joints, restores joint range of motion, resets the way in which the nerves and muscles pattern around that, gives you range of motion back, relieves pain, and improves muscle function. So it flows from there.
And you told me an interesting fact, that this is the third most used treatment in the world. Is that right? Have I phrased that right? Probably not.
Sort of. I mean, I might be out of date, but my understanding is third largest independent health profession in the world outside of general medicine and dentistry. So we are quite a large organisation globally. There's a more volume of chiropractors in America and Canada than there are in other parts of the world, but we are global. I looked at this a little while ago because I did a lecture at one of the universities and they were talking about how many university institutions were present. I think we're over 100 teaching universities globally, 40 or 50 of which are in Canada and North America, and the rest are scattered around the world. But we've got teaching institutions in Japan and Africa and Europe and Australasia, all over the place.
So would you advise that this is a treatment that people have as often as they have dentistry and medical intervention?
That depends. For the reasons we were just talking about before, that we see people for active pain management and crisis moments and try and fix their problems. And then quite a lot of patients come on occasional maintenance, and the frequency that could be as little as monthly up to just twice a year, a bit like you might visit the dentist. But it depends a little bit on what your environment is. If you're continually potentially aggravating an underlying problem, if you're laying bricks for a living and you're bent over and twisted routinely, you may need more intervention than somebody who's got, a perfect world.
So you very kindly offered to give me one of these treatments.
Okay.
I immediately walked in and saw this thing here in front of me.
Yep.
I've seen this done a lot on TikTok, actually.
Okay.
A lot on social media.
You may or may not get the best impression of
actually,
smart professional practice.
It was that encouraged me to want to come and see you, because I was thinking, that looks truly amazing, where basically these people, it's like an enjoyable pain. Is that what some people say to you?
No, in respect of chiropractic, because the manipulation itself is painless. It's a painless manipulation procedure. It's a shallow, quick movement to a joint to just open the joint. So in the same way that you could pull a finger and make it go click, it feels like that. But where there can be sort of enjoyable pain, can be, if that's a thing, is in deep tissue massage, pressure point therapy, and some of the more physiotherapy type interventions that are there, where people often say things like, oh, it feels good because it feels like you're getting to the root of it, or you're sort of digging out my problems, as it were. And so that can be a sort of enjoyable pain. But I wouldn't like to say that the profession delivers enjoyable pain. That's not, it's not what we do. So
now this could be interesting because in the office it's a constant joke. Have you ever heard of something called a wall angel?
Yes.
Now you can maybe answer this. Is that a normal thing that a human being should be able to do? So for those who don't know what a wall angel is, you basically put your back straight up against the wall and you should be able to put your arms right back and your hands there should touch the wall. I can't do that at all. I can only get to about that position. Why would that be? Is it because I've got too rounded shoulders? Have I got problems?
Problems is a strong word to use. It's a lot of the population have computer-based posture. We're on our phones and on the computers and we're driving cars. So a lot of what we do in life is in front of the body. So we're reaching forward or we're operating a keyboard. So we often get a little bit of a rounded upper back. Our shoulders come forward a little bit.
Sort of going,
exactly.
They're quite round, aren't they?
So this is what we were talking about before, about the way that we, the word they use is we plastically adapt in life. So if we've got a regular stimulus or a regular movement pattern in life, then whereas we might start like this in an ideal world as a young child, we do activities that cause us to plastically adapt to make that our new normal. So your upper back and middle back may be a little bit stiff, and your thoracic spine, which is your middle 12 vertebrae with the ribs coming off it, may be a little bit flexed in its position. So when you try to extend and flatten that back out, it's a bit difficult. It's the sort of thing that, this is some more sort of like peripheral work that chiropractors do a lot of work of, is just helping people with postural ergonomic well-being. There's a lot of work that chiropractors do now that is not just about pain management, it's about general well-being, about people feeling good and having flexible backs and comfortable shoulders and performing well in work or in sport or in life, you know, generally just feeling better. So
well, hopefully I'll feel a lot better after this and I'll be upright. I may even be about a foot taller. Who knows?
We'll see how that goes.
Just to ask you quickly about this, because it is important, and to point out as well that previously we have done a full health assessment, so it's not just like I've come in and I'm about to have the treatment. Are there any risks to this kind of thing?
If we do a proper assessment and we look at the medical status of the patient and we perform appropriate manipulation treatment in the right circumstances, the risks are very small indeed, in the same way that there's a risk in everything in life. You could look over your shoulder to reverse the car, or you could go to a Keep Fit class. Something could happen in that environment, but outside of that, the manipulation process is designed to be comfortable and safe. It's not a forceful process, it's a very gentle, finessed process, and should be pretty comfortable to receive. I mean, I would say that I know you want to feel $1 million after one session. You might do, but usually it's a process, and we usually get substantial improvements in the way people feel. Typically, it's sort of between visits 2 and 4, they feel like a real step change, and things are getting better there. And then between visits 3 and 6, we should be starting to see what we talked about before, that plastic adaptation taking place, sort of starting to hold themselves a bit better. We give them exercises and rehab intervention to help with that, so that they start doing things like wall angels and on purpose in order to get a bit better. So.
Am I correct in thinking that I'll be having a full body adjustment today?
Yes, I mean, a full body adjustment is a bit of a phrase that's sort of perhaps popped up from North America and sort of a way of talking about the profession. Really, we just treat what we find, and we just treat what's needed. So for the purpose of this, I'll just be treating the spinal column and the pelvis primarily. Chiropractors do work in the arms and legs all day long. I've just seen somebody with tennis elbow. So I mean, it's there are a lot of areas that we work in, but the mainstream area of work that we're involved in is spinal and pelvic. So we'll be doing spine and pelvis.
I'm excited.
Okay.
Do I just
Just relax your body against the table? Yeah, and the table will just do the work for you.
Whoa, that is a weird feeling.
It's all good fun, isn't it?
That is strange.
But as I say, if you've got a very sore back, or you are older or just more disabled, this is very good for helping people on and off the treatment table. So
that is nice though. That it's like a sort of
from your point of view, it's just a enjoy the ride moment, really. Okay, we'll just bring you up to working level. And I don't put my own back out when we're checking you.
Ironic if you did.
It would be ironic. Just going to go around and do a few basics. So just going to check your reflexes. So at a new patient visit, we'll screen people for underlying health problems. Because we can't assume that somebody coming in with back pain is always a mechanical problem. They could be coming to you with, heaven forbid, a tumour or infection or a trauma or something like that, or a disease of the nervous system or something like that. So we just do a general check just to make sure. There are a few other tests that we'll do, but make sure that things are as they are. So if just a little screening test, if I just push on the top of your head, does that give you any neck pain if I compress the neck a little bit?
Not particularly.
Feels okay, good, lovely. And if we just gently traction, does that feel okay?
Yeah.
That's lovely, okay. I'm just going to start having a look at what's...
That's a bit
those are sore, aren't they?
Yeah.
I'm just going to have a look at how the joints are moving in the neck. These little joints between the vertebrae, they're called facet joints. And you can probably feel as I'm coming up here, especially on the left side in here, there's a facet joint in there between the second and third vertebrae that's not a happy camper.
Why is that not, as you said, a happy camper?
Why is it not a happy camper? It's down to the same sort of things that we were just talking about, that your day-to-day work involves postural demands and ergonomic challenges. It may be that subconsciously you've been just turning your head slightly to one side, and it's just irritated that facet joint and just left it a little bit sore. What they think happens is the ligaments that cross the joint and the joint capsule just get microscopically irritated, and then the nerve endings pick up that sort of noxious stimuli from the joint and just say, well, we're not happy. So the brain says, well, we better protect the area and tighten some muscles up, and you end up with just a regional restriction and a stiff area. These are things we call subluxations internationally, but it's just a long word for describing a sore, stiff joint. And you've got a compensatory finding on the other side, lower down, but it's not as dramatic. Your first ribs are not moving very well, but that's inevitable with what you were telling me about your day-to-day postural challenges. And you've got a little bit of stiffness at the base of the neck here. So we'll just continue with the assessment. We're just finding things at the moment. Let's have you turn on your front for me when you're ready. And just start having a look at lower limb and lower back. You want to just let your knees bend for me? Okay, if I bring your heels together, you have a very small difference in leg length difference showing, but it's only a small difference. That can arise when the muscles on one side of your back are a bit tighter than the other, and it just lifts the hip on one side, so it gives the impression of there being leg length difference. These are the sort of small things that a lot of us are carrying in ourselves all the time. Yeah, you're a bit tight through there, aren't you? Okay, so you can probably feel in the left side of your pelvis here, it swings away reasonably well. It's probably slightly tender, but it's quite springy. If we press on the right side, it's much harder. It doesn't give nearly as well. So this is the joint in the pelvis called the sacroiliac or SI joint. And so your right SI joint is stiffer than your left one. And the ligaments are a bit sore because of that stiffness. And your nerve endings in and around the joint pick up that level of discomfort, so it's just why it feels a little bit tender when I press on it. Because you're stiff on the right side and the muscles are tightened up here, it's lifted the hip ever so slightly on this side, which is why we've got a marginally short right leg. And it drives the rotational stress in the lower lumbar spine here and tightens up your lower lumbar spine. So that's why your facet joints in here, which are the joints between the vertebrae, are a bit tender. So treatment in a minute will involve restoring movement to that right SI joint, and then also loosening up these lower lumbar levels and getting that moving properly. And then we should see things like the heel height level out, and a few other things change. So on that note, just to sort of illustrate something there, we'll see if this checks out. Hold your leg there for me against gravity, and use your hamstring here to stop me pushing the leg down. So just try and push up against me. Can you manage that? That's good. That's great. And if we now raise the knee off the table and hold that against gravity, try and stop me pushing the leg down using your glutes here in your bottom. Okay, you're doing reasonably well there. There's a little bit of a speed wobble, but you're all right. Put the leg down for me. Okay, we'll just do the same thing on the right side. Stop me pushing here. Okay, and raise this leg off the table and hold that against gravity. You can feel how that's swaying around more. Okay, if I push on here, you feel how that blows out and you can't resist, yeah? Okay, so it's completely weak on the right side compared to the left. Okay. That's not because the muscles are necessarily actually weaker on the right. It's because this stiff joint here is interfering with regional nerve supply to the muscle, and it's like turning the power supply off, so it feels weak. So when we've made an adjustment, we'll come back and we'll retest that glute relationship and see if that muscle switches on again, and hopefully you'll be a bit stronger. But you can really feel it in yourself, can't you, when you...
Yeah.
Okay, you've got a few tight spots in here as well, haven't you? Okay, so you can probably feel those in there. Yeah, a little, what we call a cluster fixation here. So between the vertebrae you've got pairs of joints going all the way down. They're called facet joints. And then from the level in your case of about the third vertebrae here, the third thoracic vertebra, through to about the seventh vertebrae, you have a group of facet joints that are stiff and tight. That's what we were talking about before as to why you struggle with your wall angel, and also just the simple postural changes that have taken place. So we'll make an adjustment in here to try and see if we can get some movement into your thoracic spine and get those joints released, and you should feel a bit more flexible through here as well. Okay, that's an initial assessment. So if we were sort of drawing up a sort of a shopping list, we would go right SI joint, lower lumbar spine, middle thoracic spine, and then clear these neck restrictions. So there's 4 or 5 areas of adjustment to make. Okay. And then we can do a little bit of muscle release work and you should feel better.
Excellent, okay.
Okay, so you're happy for me to do that, or we'll just get going? Okay, right, so you'll just pop yourself back where you are. I'm just going to start getting you moving between your shoulder blades here. So what we're going to do here is we're going to just push down a little bit, and you probably feel that's already moving. Yeah. I'm just going to give that a little push with a little bit of strength. Okay, well done. That's come as a little bit of a shock. I would suggest that didn't hurt. It just made a little noise.
Yeah, it was a nice shock.
Okay, good, excellent. Okay, but it's a release of pressure in the joint fluid, and you just hear that as a pop in there. So that's a facet joint that's been stuck and not moving very well for a long time. Okay. As it releases, it'll make a noise as it goes. So apologies if that came as a surprise, but it's part of the process. Okay, we're going to start by getting some movement also into this right side of your pelvis. So we're going to just put some pressure through here. I'm just going to drop the table down underneath you, just like so. It's designed to do that. So this is just a mechanically assisted stretch. It just gets some movement into this joint. Let's do that 3 or 4 times just to start to get a bit of wiggle room into the joint. You all right? Yeah. It's a funny old feeling, isn't it? Yeah. Okay, that's lovely. Okay, now we'll start to loosen it up more directly. So can I get you to lay on your left side for me, face me this way? The lady, I would manage you slightly differently. Yeah. Okay, a little breath in for me, and out for me, and just breathe through and relax. I'm just going to get this moving. There we go. You might have felt that go pop in the lower back. That's what we wanted. Turn the other side for me.
Wow, I'll be like a new man after this.
You will be. I think what this illustrates really is that obviously you've come without any real specific problem other than bits of sort of vague stiffness and a bit of mild discomfort. But when we start looking, there's quite a lot there. So it's applicable to a lot of people in the population that wouldn't really realise that they're walking around with aches and pains that they could probably get rid of. Breath in for me and out for me. Just breathe, relax and just let them go. There you go. Nice healthy pop in there as well. So we're going to spend some time with you on your back just to clear the neck. It's quite a nice experience.
That's good.
I think people build up in their minds fear of the unknown sometimes. They wonder if treatment might hurt or whether it's going to be unpleasant, but actually think, oh, it's actually a rather pleasant anticlimax. It's all different and interesting, but it's arguably it's nice, you know. Just going to remind myself as to where you're a little bit tight in here. So I'm going to just start by very gently clearing a restriction here. So we just gently bring you to the side. Okay. It's a lateral tilt rather than a rotational twist, and it's a very shallow movement. So just bring you around and just give you a very shallow little pop in there, and you just feel that go pop in the joint. Okay. So it's just a little twitch rather than a big rotational movement. That's good.
Oh, that one went.
It was a good old clearance, wasn't it? Super.
Oh, that's a good one.
And you hear those a lot more because they're near your ears.
Yeah.
So, you know. All right?
Yeah.
Good. Funny old feeling, isn't it, when you're...
It's almost like my sort of body's like going,
Yep.
At last it's been loosened.
Well, that goes to the root of how it all works, because we now know from neuroscience over the last 10 years especially that a stiff joint interrupts the messages carried by the nerves from the joint to your brain, and the bits of the brain that control the muscles in the body send the wrong command messages down to the muscles in the body as a result of that. So once we clear the joint, the nerve pathway is restored and the brain sends messages back down to the muscles to say, it's okay guys, we can relax, we can be at our normal resting tone. So you do actually get that kind of sense of like somebody's taking the handbrake off. It's just like, it clears the, relaxing really, isn't it? Okay, we're done for today in terms of adjustments. I can do some muscle work if you'd like me to, but apart from that, we're done for adjustments.
Yeah, if you'd like to, I'm up for some more.
It's a case of doing treatment entirely thoroughly, really, because you're here for a proper appointment. So really, I need to turn you over again onto your front. Just pull down on your legs here. So you might be able to feel how the heels touch now. So your leg length is leveled out, which is lovely. That's just because the tone of the muscle has relaxed, the pelvis has dropped down, and you're probably able to feel when I spring on there now how that's gone soft and comfy. So the joint's functioning better, and these are probably a bit less tender because we've normalised the joint capsule movement. So just go back to this muscle test just out of interest and just raise the leg here for me. So you see now you've got better control. You're not wobbling around nearly as much as you are, and you can already see your glutes popped out, so it's switched on. So if I push on here, suddenly you've become a strong man and you don't fatigue. You see, I'm really leaning on that and you're just stopping me. So you can feel it switch on like we've turned the power switch on. So that's really nice. You know, it's shows that the relationship between the joint, the brain and the muscle via the nerves is very much there, and that's what chiropractors are working with. I'm just going to loosen off a muscle here behind your hip joint. You all right? Okay, maybe a little bit tender. This is where you get the nice pain. I think that sort of feeling of better muscle control and being stronger is arguably quite striking. It's blimey, I didn't realise I was carrying that. That's where people can go off in the long grass and start describing this sort of thing as like a magic trick. It isn't. It's because we now know that it's is just mediated by our nerves and the nervous system, and ultimately by this central computer up here, the brain, which is controlling everything. So I'm just going to do a little bit of gentle muscle work here in your neck, just to alleviate these tight muscles. There is some of the treatments that we deliver that are positively pleasant. And, in fact, I would argue most of the treatment process is very comfortable, and once you get used to it, it's something that most people look forward to. You can feel how that's more comfortable through that. And the same on the left side. It's all that taut band of muscle down the left side of your neck has just relaxed and evaporated. You'll be able to move your head like an owl and feel looser in yourself. So what spiked your interest in chiropractic treatment? Have you been talking to some people?
Mostly online. I've seen videos of it, and I thought, wow, it's interesting how people go in and you've got like a limp or you've got some major back problem, and then they have a treatment and they're completely fixed.
Yeah, absolutely. I mean, the online videos will, like everything, they'll edit that and it'll make it look like it's fairly instant. I mean, we do get some quick results, as you've already felt that you've got greater strength in your right gluteal muscle group, and this muscle here is relaxed down the side of your neck. So there are changes, but you need to make those adjustments and maintain that good situation for a few weeks before the body really stabilises and everything gets better. So
Yeah.
but yeah, that's it's a good source of resources to see online as to how some people summarise it. Like everything on the internet, there's good and bad.
Wow.
All right,
I
good.
love that.
Okay, job done. Thank you.
That's amazing.